Every heartbeat matters, every second counts, and when it comes to health, every single decision that you take can change your life forever. Hi, this is Sonalee Kulkarni, and welcome to our podcast, Where You Go First Matters. You know what we do here? We talk to the experts in the medical profession and get to learn a new information about a new topic every week. Presented by the Ruby Hall Clinic, today we have Dr. Pranav Mahadeokar with us, who is a consultant and head of the department radiology at the Ruby Hall Clinic. Welcome, doctor. So we are going to talk about radiology. How has imaging saved lives?
So imaging has evolved over a period of time. Earlier it started with an X-ray, then we had CT scans. In CTs also we started with a one slice CT. Now we have a 1152 slice CT at Ruby Hall.
Yeah.
So
what does it mean?
So it's basically better image quality.
Okay.
And apart from a lot of other advantages. So basically as imaging has evolved, so we are able to pick up a disease early. So if you pick up a disease early, we can start the treatment early.
Does it mean you can pick up a disease even before it starts showing symptoms?
Yeah, so that's a very important thing to know, that preventive radiology in itself is a big specialty.
Yeah.
Till date, we used to do imaging when a patient has symptoms.
Right.
So now the new trend is, which is a very new concept right now, that for the heart you do a CT angio, for the liver you do an elastography. So basically the new trend is you try to pick up the disease early so that you can start treatment early, and you can probably, there is obviously a better clinical outcome.
Absolutely. So doctor, at what age should people start going for regular screenings, whether it's mammograms or other scans?
So there is, as you know, the human body, we have multiple organs. Suppose there is a breast, there is a liver, there is a heart. So according to the various international guidelines, for every set of organ, we have different guidelines, and mostly we follow the American or the British set of guidelines which are set. So talking about mammography, every female should ideally have her breast checked with a mammogram after the age of 40 years. So depending on her family history, depending on other risk factors, she can do it either once a year or once in every 2 years.
Okay.
Because similarly, there are other cancers as well. For example, there's an international trial, Nelson trial, and all these trials for lung cancer which are going on.
Yes.
Patients beyond the age of 50 years who are heavy smokers.
Yes.
That is more than 20 pack years and everything. For these patients, we have a low dose CT scan.
Okay.
So in this, we can actually screen their lungs, check their lungs. Patients who are alcoholics or patients who are,
so basically check your lifestyle,
check
and
your
if
lifestyle.
you have like any lifestyle corrections that you should ideally be doing, you can decide your scans accordingly.
We can decide it, but it has to be recommended by a doctor.
Okay.
Because there is no perfect test for anything. You talk about, every test has its own pros and cons, own limitations. Like if you see, there are many executive checkups who market a whole body this, whole body scan.
Yes.
So what happens is there is no perfect test. Like giving you an example, there is no tablet which can cure all your problems in your body.
Of course.
Similarly,
it can't be so generic.
It can't be. So similarly, every test has its limitations. We at Ruby Hall do all the advanced imaging. We even have a whole body MRI. But what we do is we try to keep it very rational, because we can't just take every patient, put him in the machine and say,
of course,
let's do a whole body MRI and tell if you have cancer or not.
Of course.
Because as per international guidelines, they have said that even if you over-evaluate a person, maybe I have a disc or maybe I have something in my thyroid, I don't need to chase it if I'm completely normal.
Okay, that's a new aspect. Over-evaluating also.
If it's rationally, if it's indicated, if your doctor is recommending it, if you have particular symptoms, then you can probably do the test.
Okay.
But being very aggressive about it, let's do this, let's do that.
Yeah, there are a lot of people who are pretty compulsive about their health. So it's like on the spectrum, you see people who are absolutely negligent, and then on the other end of the spectrum, there are people who like constantly want to visit the doctor every week if they have a little sneeze also. So that can't be also possible for.
You need to balance it properly.
You need to balance it. What role radiology plays in tracking diseases like cancer, chronic diseases like heart disease?
It's very important actually. All these chronic diseases, chronic as in long-standing diseases for people, long-standing diseases need to be monitored. Very basic example, if you talk about a cancer, the patient has taken chemotherapy. We need to make sure whether the cancer has reduced in size, whether it's still there, whether it has increased in size.
And not spread across.
Even for simple like TB, tuberculosis is one of the commonest infections in our country.
Yeah.
Even patients who are having anti-tuberculous therapy, we need to monitor them, track them, whether the tuberculous infection has reduced. For that, we do CT scans, we do chest X-rays. So in every disease, be it heart disease, tumor, be it infection, radiology plays a very important role in monitoring
Arthritis?
even in arthritis, even in joint diseases. It plays a very important role in monitoring the treatment response.
Okay.
Like how in diabetes, diabetologists, they keep on checking the sugar and then
Yes.
they adjust the doses.
Yes, accordingly.
Similarly, in various specialties across medicine, we need to do imaging and evaluate the patient for treatment response.
Right. We spoke about breast cancer and mammogram. For a woman, do you actually need to feel a lump for a mammogram or an early screening?
So early screening is very important with respect to breast imaging.
Yes.
Many times a patient might not feel a lump even though she is doing breast
So you don't have to
self-examination.
wait for something like that to happen.
No, we have to start screening beyond the age of 40 years. And annually or once in every 2 years, we have to do breast screening by a mammogram, because what happens is few millimeters, if the mass is a few millimeters, that patient is not able to feel it.
Absolutely.
So if the patient has dense breasts and we are not able to clinically feel the lump, many times these patients, when they come for a mammogram, we can see a few millimeter size small cancer which is sitting in the breast.
Yeah.
So that is the importance of early screening and regular mammograms. They should also be done by women who have a very strong family history of breast cancer.
Right, of course.
And in India, I think it's one of the leading causes of cancer.
Yes.
And I feel, as per guidelines, we should start screening beyond the age of 40 years.
For everyone.
For everyone.
I think there are a lot of breast awareness campaigns happening, and even Ruby Hall is doing awareness campaigns, and I'm sure awareness camps also across the state. But doctor, there are a lot of myths about radiology. A lot of people feel that if we go for a lot of scans, they could cause cancers.
Yeah.
There are a lot of myths about the contrast dye. Is it really harmful?
So yes, so basically contrast only in a selective number of patients, like in 5% of patients who have kidney disease, who have allergy to contrast, only in those patients. 95% of patients who come for routine examinations, we don't have to worry about it. But only in the selective subset of kidney disease or patients who have a previous allergy to contrast, in these patients we have to take extra care. Like we have to discuss with the nephrologist, their kidney specialist. He will tell us whether the risk, we have to compare the risk benefit of the scan.
Okay.
And if the patient really needs to go ahead with the scan, even in these patients we can do the scan.
Okay.
So as technology has evolved, even the contrast is basically a dye which we inject.
Yes.
So even the contrast compositions and the quality has become better over a period of time. So at Ruby we use the best contrast, whichever is up. The best contrast which is available we use at Ruby Hall. Also, from our point of view, we have to take care by checking the creatinine before we use dye in any patient.
Okay.
So creatinine is basically a kidney function test.
Okay.
So before giving contrast to any patients, routinely we check the kidney function test.
Okay.
And if the kidney function test is abnormal, then we counsel the patient, then we discuss with the nephrologist.
Okay.
We probably discuss the risks and the benefits, and then we decide whether to go ahead with the test or not.
Okay.
Or if there is any alternate modality. Suppose there is a patient who comes for a CT scan, but we can't give contrast because the kidney function is deranged. So we might convert the patient to a plain MRI, or we do an ultrasound in that patient.
Okay.
So this is basically teamwork between the treating doctor and the radiologist and the nephrologist.
Okay. And what about people who feel the risk of cancer because of the radiation that we have in the scans?
So theoretically, there is a risk of radiation, and if you ask me, I feel people are very radiation phobic, which shouldn't be the case.
It's like a big phobia.
It is. But if you ask me, diagnostic level radiations, what we use in our routine CTs, in our routine X-rays, these in a single exposure do not cause cancer.
Okay.
But still, to convince people, you can't. You have to give them data. So I'll give you some data. Basically, there is a 20 millisievert radiation limit. So this 20 millisievert radiation limit, if a patient is exposed to a 20 millisievert limit over a period of 40 years, and suppose it's 25 millisieverts in 40 years, then that person has a probability of 1 in 1,000 to get a cancer.
Okay.
So this data has been compiled from Hiroshima, Nagasaki. It is one of the biggest radiation trials which is evident in the world.
Yes.
So if you think about this 20, and basically if you ask me, one chest X-ray is 0.1 millisievert. One CT scan is around average 6 to 7 millisieverts.
Okay.
So 20 millisievert across 40 years cumulative exposure, that patient will have 1 in 1,000. But not doing a scan because of radiation has more risks rather than.
So you can say safely that confidently that scans are safe.
Absolutely, because there is a principle called ALARA in radiology, as low as reasonably achievable.
Right.
So all our scans and everything
I'm sure They're regulated.
Yeah, they're regulated.
So whether it's a CT scan or an MRI or an X-ray, they are all under these regulations.
Yes. So not only patients, we even ensure that our team, our technicians, our sisters, our nurses who work with us, they are also protected and they are not overexposed to radiation. So we have those guidelines in place.
So I'm sure there must be a situation where a patient is scared to go through a scan. What do you do to make them feel more comfortable and not get scared or feel the fear?
So we have a lot of nervous patients. First of all, see, 8 out of 10 patients, we just tell them, don't worry, it's a painless thing, it's a fast thing. So these patients agree. But I feel one advice we could give, through this podcast, we could tell people that you discuss with your doctor, you discuss with the person who's doing the scan. Mostly it's a technician or a doctor. Talk to them, discuss with them.
Yeah, because the whole atmosphere is so intense and scary. You're all alone in that machine. There are various sounds and you can't move. So I think all those the environmental pressure, the ambient builds up another pressure on you. You have to be really steady. So what do you do in that case?
Yeah, so basically this I think you're talking about claustrophobia. When a patient goes inside, they're very claustrophobic, and these patients, how much ever you counsel them, you might not know. There are people in this room, they might be claustrophobic.
Yeah, absolutely.
So that's very common actually. Fortunately, in our, at Ruby, we have the latest MRI. So 90% of the times we can do a scan in 10-15 minutes.
Okay.
So we have trained a person, I'll just share this with you.
Yeah.
Senior person working with us for 30-35 years. We call him a vocal anesthetist.
Okay.
So he goes in, he talks to the patient.
Yeah.
And make sure the patient is okay.
So distracting them.
Yeah, distracting them. And it works.
Oh, wow.
And these patients don't need any sedation, don't need any anesthesia. Probably in 1 patient out of 10, we still have to sedate.
Yeah.
But out of these 10 patients who have claustrophobia, 9 of them, this technique works.
Okay.
So with advanced imaging, with AI-based faster imaging, with a human touch to it, we are able to avoid anesthesia and sedation.
So I was just come to this point. How are these modern technologies in advanced imaging technologies, whether it's AI generated, are making scans faster, safer, and more accurate in patients?
So it is not just on paper. Actually, this is proving to be of very good clinical benefit to the patients. This AI, everyone talks about AI, but we are actually seeing it in use at Ruby All. Because to give you an example, an MRI of the knee earlier used to take us 20-25 minutes on our same MRI machine. Now with the latest AI, we can do the same thing in 9-10 minutes.
Wow.
So that it gives you basically more speed, more quality,
and more accuracy.
More accuracy in diagnosis. And one interesting thing is, earlier on our CT scan, we used to sedate babies. So not only the babies were a problem, their nervous, anxious parents also used to be a problem.
Yes.
But now with the new CT scan, with the latest speed and AI and everything, we've not sedated even one baby in the last 1 year.
Oh.
So the scan actually takes 1 second because of the advanced technology and the AI and all sorts of things in that. So I feel this is a very ground level clinical point which I want to share. Right. So not sedating even a single baby in 1 year is a big achievement according to me.
Yeah, it's a big. So basically AI has a lot of boon, not just bin.
It has.
That's amazing.
But it has to be used properly.
Yeah, I think all the technology and all the advancement that's happening across the world, not just in medical field, depends on who is handling it and how is it being handled. Yes. So it's not just the machines, the experts, and that's why we bring experts like you on our podcast to talk about these complicated facts about medical and medicine that people sit at home and probably are not aware of and just getting unnecessarily worked up or scared about. Thank you so much, doctor, for giving us such important insights about radiology in today's episode. So guys, if you resonated with today's episode, not just today's but all the other episodes in here on our podcast called Where You Go First Matters, spread to people who you think need to hear this, need to learn and educate themselves. Also, if you have any questions, any inquiries about health related queries, just put in your comment box and send it to us. We have experts to solve them for you, to give you insights. And do not forget to subscribe to our channel. Stay informed, inform others, and stay fit, stay healthy. Take care.